Good evening. Assalamu alaikum. Welcome to tonight's episode of The Daily Dose, COVID Conversations with CAIR, live cast every evening at 8 p.m. right here on CAIR social media. My name is Zainab Chaudhry. I'm the director of CAIR's office in Maryland. I'll be co-hosting tonight's show alongside my colleague, Dr. John Robbins from Massachusetts. John, can you hear me?
I can. Thanks so much, Zainab. It's a pleasure to be here with you, and it's a pleasure to be in the great state of Massachusetts. We're going to be joined by two excellent panelists tonight, Dr. Sana Saeed and Dr. Mazen Khairullah. It's a great opportunity, and we're really fortunate to have them speak with us. Dr. Zainab, do you want to tell us a little bit about how things are going in Maryland?
We are seeing an uptick in the number of infections. I think like everywhere else in the country and around the world, places where the pandemic has not peaked yet. So some of the hospitals around the state are starting to see an influx of patients coming into the ER. And I think a lot of folks are also wondering, if they do become symptomatic, what do they do in that case? Should they wait before they go to the ER? At what point do they make that call? And so I'm super excited about our guest panelists tonight because I really feel like this is a very heavy topic, obviously, that has impacted so many people in so many different ways. I think all of us know somebody, or if we ourselves have not been directly personally impacted by this, we know somebody who has been impacted or who's been diagnosed as positive, COVID-19 positive. And so I think, inshallah, hopefully with tonight's session, we can help answer some of the questions that people have and share some of the content and information about the pandemic itself.
Absolutely. I think we have a real opportunity here to address some concerns and questions of the community and also to provide some information. One point of information that we specifically wanted to flag was an update that I understand we're going to be giving regularly during these series of conversations. As of 7 o'clock p.m., the world has 932,000 confirmed cases of COVID-19 with 46,000 fatalities. In the US, that number is 213,000 with about 4,500 who have passed away. So in these times, it's more important than ever that we are staying aware of what we can do to, in our own households, be measures against this kind of terrible disease that's going around, and what we can also do in our communities to strengthen that foundation. I know up here in Massachusetts, we're seeing incredible community resiliency already. Mosques across the state have gathered together, especially during the past weekend, to create PPE, personal protective equipment, for the hospital community, to be standing strong together with them, to deliver that to nurses, medical workers, those on the front lines, and to make sure that there's not a single person who is putting themselves in harm's way that is not given the full support of the American Muslim community. I don't know if you have efforts going on like that in Maryland, or if you can speak a little bit toward what the community is feeling and engaging in down there too.
Yeah, John, in these times of crisis, I think we really tend to see the best of humanity come out as well. And Muslim communities are always, very helpful in these kind of moments. We see Muslim Masajid and Muslim organizations that mobilize to provide support and relief in the hardest hit areas. Over the last few weeks, for example, we'd have a sister organization, Ikna Relief, that's been going door to door in some parts of Baltimore City to deliver meals to the elderly who are either at high risk of infection or who can't make it out to the grocery stores for various reasons, delivering meals to them and critical supplies. And so, alhamdulillah, it's really, I think, powerful to see that response from our brothers and sisters. And I think that's a silver lining on this cloud that we're struggling with in terms of seeing the resilience and the positive stories that are emerging. And with that, John, I think we could segue maybe into bringing on board our guest panelists, Dr. Sana Saeed, Dr. Mazen Khairullah. I hope I pronounced that right. Dr. Khairullah, can you hear me? Do we have them here with us yet? I'm sure they'll be joining us shortly. Dr. Khairullah, I think I saw you just sign on.
Yes,
can you hear us?
you. Yes, I hear you.
Great. Thank you so much for being available to join us tonight.
Thank you very much indeed.
If you could take a couple minutes just to introduce yourselves. Dr. Sana Saeed, are you there as well? Can you hear us?
I think your microphone's on mute, Dr. Saeed. There we go.
I can hear
There
you.
we go. Okay, great. So both of you could maybe take about 20 seconds just to introduce yourselves.
Sure. My name is Mazen Khairullah. I'm an infectious disease and critical care physician. I'm an associate professor at University of North Dakota, and certainly North Dakota is not the exception. Actually, it is part of United States, and we started seeing patients here at North Dakota. In fact, actually, the influx of cases has increased remarkably over the past few days.
Well, we're certainly sorry to hear that, but thank you so much for your attendance to the patients there and obviously to our community here. Dr. Senna, can you speak briefly about your background as well and what involves you in this situation?
Sure. So my name is Ana Sayed. I'm a neurologist by training. I have subspecialty trainings in MS and cognitive neurology. I work full-time for a pharmaceutical company doing drug development research, EMD Serrano. I'm a medical director there. But as part of my volunteer activities, I am a health policy and advocacy director for American Muslim Health Professionals. And as some of you may be aware, that we recently created a coalition with a few partner organizations like Imana, ISNA, and the Fiqh Council. And we have come together as a national Muslim task force for COVID-19. And as part of this task force, I am chairing their policy committee. And on that front, we're doing a lot of advocacy work related to COVID-19 related bills and advocating for various healthcare related issues, especially like PPE and ventilators and other equipment that you guys mentioned earlier.
This is all really great work. Thank you so much, Dr. Saeed, again, and Dr. Khairullah for being here today with us. Obviously, we know that this is not the first pandemic that has impacted us globally. The 1918 influenza pandemic, since then we've seen the SARS pandemic, also the H1N1 influenza outbreak in 2007, and then after that, the Ebola. What makes this particular pandemic, Dr. Khairullah, what makes this particular pandemic different than the previous ones, and why is it creating more alarm?
Well, like any new virus in the community, there's no immunity to that virus. So we transmit that virus very easily among people. And what makes this different than the previous coronaviruses that we had, like the MERS in Saudi Arabia and the close to 30 other countries, and the SARS in 2003 in China, is that the dynamic of transmission is different here. The dynamics here are completely different than what we saw in SARS. One example is that this virus is contagious in the incubation period. And the other thing is some of those patients do not have a lot of severe symptoms. They may have some sore throat, a little bit of cough. They may have some fever, but they don't feel like they should see a physician. So they walk around in the community, but they transmit the virus to other people. In SARS or MERS, those patients presented with severe symptoms. They came to the physicians right away, and then physicians started to isolate those cases in the community so they are not contagious to the others. So I think the major difference between this virus and the previous viruses is how easy this virus is transmitted among people, and it is most of the time people do not know that they are sick.
Meaning that they can be vectors carrying the virus and not even realize that they're doing so. And from what I understand, what's the incubation period for this particular virus? Do we know?
Yeah, we know that it varies between 1 day to 14 days. On average, it is 5 days. Most of people would manifest with symptoms within 5 days, but it may take up to 2 weeks. And that's why everybody hears about the 2-week quarantine, that people have to stay at home before they can come out if they were in close contact with other people for 2 weeks. But now we're emphasizing that everybody should stay home, not only those people. And we'll talk about that too.
And so if someone does feel maybe slightly symptomatic, they feel I've got a little bit of a sore throat, a little bit of a headache, maybe a slightly elevated temperature, but it comes and goes. What would be the recommended course of action for an individual in that situation?
So now we're asking people to stay home if they feel sick. They need to call the healthcare office, either the urgent care or their MDs or whatever primary care physician they have. They just discuss those symptoms with the care provider over the phone. And that care provider would be able to tell them that those symptoms are most likely consistent with COVID-19, but the severity of those symptoms is mild, so you don't need to come to the hospital, you don't need to come to the clinic. And this is important because we really do not want to get those sick people get out of their homes and go to the community and the clinics where other sick ones are there, and they start transmitting the virus to other people. So most of those cases, and we can say like 80% of cases, are actually mild to moderate cases that can be managed at home, and there is no need for them to come to see a physician. So they can be managed through telemedicine, and now we activated this, and now we can do so many other ways of telemedicine. We can do it through our WhatsApps or Facebook with our patients. So
that's such an important point that you made, Dr. Khairullah. And the social distancing piece has also been so strongly emphasized, partly because this virus is so contagious and it has such a long incubation period that people could be vectors for it without even realizing that they are harboring the virus in their bodies. And so one of the questions that a community member had tonight was that, for example, if they wanted to go to the grocery store and purchase groceries, how can they protect themselves by making sure that they're not bringing home that virus with them?
Okay, excellent. Can I have the first slide, please, so we can show the audience the modes of transmission? John?
I think our back end might be able to handle that a little bit.
Okay.
There we go.
Yeah, give me the second slide after my name. Yes, this one, please. Okay, so it's important to understand that this virus is transmitted. Can we do a slideshow, please? So it is important to understand that this virus is transmitted through what we call droplets. And those droplets are those small particles that are ejected out of our respiratory orifice from the nose or from the mouth when we talk, cough, or sneeze. And you can see that each one represented in the blue circle up has cells, viruses, and water. It really depends on the size of this particle or this droplet. If it is more than 10 micron, it will fall just next to the person who's actually ejecting this droplet. It will not be more than probably 3 feet. And that's why we say you need to stay away for 6 feet from that person who's coughing or sneezing, and that person is sick. So a single person can actually eject hundreds or millions of these droplets, but most of these droplets will actually fall on the floors surrounding that patient. If you get close to that patient, you may contract the virus directly through getting these droplets into your mucous membranes through your mouth, the nose, or the eyes. So that's why we need to keep a distance from other people. So to answer your question, if we go outside for whatever reason, number one, we should limit our exit from home only for necessities. If we don't have to get out of the house, we should not go out because we really need to stay away from other people. If we have to go out, we have to stay at least 6 feet apart from each other. So you can go and shop, you can do everything, but stay away from 6 feet apart. The other thing is you're going to touch surfaces, and those surfaces can be contaminated. So please do not touch your eyes, mouth, or nose with your hands. Your hands may be contaminated. And while you're shopping, you just continue shopping, but do not touch your face. Once you finish, immediately wash your hands. Wash your hands with soap and water or with alcohol if you have it available. Now, there's another mode of transmission, but it is mainly in the hospital. But it's very important because you started probably hearing on the news about what we call airborne transmission. And this is for particles that are less than 10 microns. Mm-hmm. Those particles will be flown in the air, and you may inhale this. Well, in the community, we do not know if this is really an important factor or not. However, in the hospitals, it is very important factor because certain procedures we do in the hospitals may generate those kind of droplets, or what we call droplet nuclei. They are airborne, and the transmission is completely different, and we have to protect ourselves in a different way.
Well,
now,
that's
go ahead.
Sorry, Sorry, I'll use this opportunity to segue since we do have a limited amount of time, and I'd love to hear the perspective of Dr. Saeed as well. So we have the infectious disease perspective on this, which obviously is your expertise, Dr. Kharallah. And Dr. Saeed, I'm wondering, from a community health and a public policy and advocacy perspective, what does it mean that we're putting, in many cases, our healthcare workers who are on the front lines here, who potentially have not one but two modes of infection, in these situations without adequate PPE, personal protective equipment, who are going home to their families, maybe once married to a teacher, maybe once married to someone who works in a grocery store, and have the potential to spread this even more widely? Are there public health measures we're not taking? Are there ways in which we can safeguard our community's front lines in ways that we're not doing now?
Absolutely. So once we initiated this policy committee that I'm a part of right now, this was one of the primary, most imminent part of our policy issues that we had to advocate for right away. And this is at the forefront of all major medical organizations. I will say that right now, there is an inadequate amount of PPE at American hospitals in general. The ones that have PPE right now, they will run out in a matter of days. In most hospitals, especially the heavily inflicted areas like New York and even Boston and Massachusetts in general, there has been such a high escalation of cases over the last couple of days. So this is the discrepancy that we have. We have a lot of patients coming in. We have, for the reasons that Dr. Khairullah just defined very well, we have a need for these PPE, for these frontline healthcare workers, and we don't have enough of them. There was something called the Defense Production Act that was partially put into place, but not fully invoked yet. And that could help compensate for some of that need. However, we've still fallen short on that. And a lot of the advocacy work that we've been doing as part of this national task force has been in writing to the Human Health Services and also to the White House task force headed by Vice President Pence, and even like sending out letters to CDC asking them that something needs to be done. Now, the reason I mentioned the CDC right now is because due to this deficit in PPE, the weird thing is that the CDC modified the guidelines for healthcare workers. I do not consider that to be a solution. The problem is an inadequate amount of PPE. The problem is not that the guidelines protect the healthcare workers. You cannot change the guidelines to compensate for an inadequate number of equipment that you have. So this is something that we are trying to hit on multiple fronts. We've even sent a letter to the US Surgeon General. This is something that should have been done. I have to say this 3 months ago, in my opinion. If you look at the comparative analysis that we have with other countries, we are so way behind. Sorry, Zainab, go ahead.
No, Dr. Sana, this issue is so close to my heart, especially because having family members who are healthcare workers who are on the front lines providing services to patients who are positive. And I know many of us are in that situation. Every day you worry about their well-being, you worry about whether they have the adequate protection that they need in those settings, and just, making sure that they take precautions when they come home. Dr. Khairullah, I was looking at our conversation that we had earlier today, and you mentioned something about that there was a difference in the mortality rates between Germany, Italy, and the United States. Why are we seeing such a discrepancy between the mortality rates in these different parts of the world? Is it because the United States has waited too long to implement these procedures and social distancing kind of procedures, or can you provide more insight into that?
Well, let me just comment on what Sana was saying. In Italy, 10% of the cases were among healthcare workers. So 1 out of 10 patients who were infected with this virus was a healthcare worker, could be physician, a nurse, or therapist. We can easily say for the public, stay home, stay away from those patients. What we say to physicians, go and see those patients. So when we say this, we need to make sure that we have the PPEs required to protect our physicians. And when a person is infected, there are other people who would be quarantined, and then we may lose 30% of our healthcare workers, and then not enough people to care for the patients who are in the community. Now,
And Dr. Senna, that actually leads me to a question about, if we're talking about what we can do for existing care, one of our guests is asking as well, what can we do about a vaccine to prevent this from happening in the first place? Is there a way in which we can, how far out are we from a vaccine? Why can't we use existing vaccines for things like the flu or modify those? Every year we get a different flu vaccine and it's pretty nimble. Is a vaccine on the horizon for this in a meaningful way that we can not just be reactive? Again, that's one of the questions that's coming from our feed.
Sure. So drug development, you cannot adjust an existing vaccine for a new disease process. And I think Dr. Hirola touched on the fact that this is a different type of virus. It's novel in its mechanism, in its microbiology. So to answer the first half, that we cannot adjust existing vaccines to treat this current virus. Secondly, so in terms of when we can expect, the timeline that the administration and some of the drug development collaborators have put forth of 18 months in itself is extremely expedited. Now, we have to understand that there is a balance of efficacy and safety that you have to take. And there's multiple phases of drug development that you have to go through. For that reason, we have barely started the process, and I think 18 months, they're really going to exert the maximal effort that they can. And I would say that I'm hopeful that they would succeed, but I do not think that it is a matter of a few months. It will be more than a year, and 18 months is probably the bare minimum.
Yeah. And we know that the vaccine development process, a lot of people don't realize that there's so many different factors involved with that. In addition to the vaccine, we know that there are drugs that are in various stages of clinical trials that are not even, I don't believe that they're in the FDA yet for approval, that they've been submitted yet. Can you provide us some insight on some of those treatments and the clinical trials that are happening, as well as some of the medications that are being used for off-label indications? Like we know that there's a drug cocktail with hydroxychloroquine and azithromycin that there's been a lot of excitement about. I think President Trump was on Fox News also talking about that. And before he knew it, people went to the drugstore to get a prescription for it. Can you tell us a little bit about some drugs that are currently being used on an off-label basis and what drugs are currently in the pipeline that hopefully will be approved for this indication?
So just to give you a high-level overview, first I want to start off
in 20 seconds.
Yes, a hydroxychloroquine question first off. I really want to impress on everyone that they shouldn't go out and buy hydroxychloroquine. That you should not be using any drug off-label without the direction of your physician. I know there were deaths because of off-label use of hydroxychloroquine without the supervision of a physician. These drugs are not a joke. They come with side effects. Hydroxychloroquine causes heart side effects, to put it simplistically. So this message needs to get across that it has to be in a controlled environment. The fact that they were doing a clinical trial with hydroxychloroquine means that it was still under investigation. It does not mean that it works. I do encourage that. I mean, of course, I support these clinical trials and I think they should continue, but we do not have enough outcomes yet on those trials to say that they work. And they were relatively small studies that were happening. So some of that data needs to be reviewed properly before you can go out and start taking those drugs. That's very important. I know that all pharmaceutical companies, quite frankly, including the one that I work for, have come together to work in this work in efforts to develop new medications. Most of these trials are in early phase. So by that, I mean like phase 1 or so, which is the very first phase of 3 phases prior to approval, just to be clear.
So at this point, we're focusing on symptomatic treatment and prevention, right? Prevention, an ounce of prevention is worth a pound of the cure. So Dr. Hirola, do you have suggestions on ways that people can help prevent themselves from contracting the disease?
Let's get the second slide, if you don't mind, please. Waiting for medications to be effective and waiting for the vaccine that may not be available for at least another 12 months, well, the only way left for us is to stay away from each other. Can you hit next, please? Because I need to see. Okay, great. No, back. Okay, here. So it is very important to understand what we mean by this, what we call R0. Every single person who has the virus has the ability to infect 2 to 3 people around him. This is in comparison to measles, for example. A single case of measles can infect 18. So the virus is not that much contagious compared to measles, but we know what measles is when it comes to the class in the school in the old days. Actually, everybody in the class gets infected. Here we need to, every single case, if it happens, it infects 2 to 3 people. So we need to decrease that number to less than 1, meaning that 2 cases will infect 1 person only, or even better, if none of the cases will infect anybody else. This will happen only by staying home, distancing from each other, and waiting for other trials for other medications or vaccines to work. The reason why the mortality rate in Germany is low is because they have so much testing in the community. They tested everybody almost, and they detected a lot of cases, and then majority of those cases are mild cases. That's why the mortality rate is less than 1%. Our mortality rate so far in the States is around 2.1%. And the mortality rate in Italy was up to 10 to 12%. Meaning that if mortality rate in Italy 12%, that means they have at least 1 million cases that are not identified yet. So the transmission in the community will be very easy with this majority of patients are still in the community. And that's what we have still in the States here. I think we have a lot of other cases that are in the community among us. So if we go out to the community, we're going to contract this virus one way or the other. So that's why we're emphasizing the most important thing at this point is to stay home.
So Dr. Carola, on that note, a lot of folks are wondering whether we should anticipate a second wave. Are we headed towards a place where we're going to soon be hunting for our meals and growing our own vegetable gardens to feed ourselves? Or do you see hope? Like what gives you some source of optimism? Because I think a lot of people are looking for, something to.
Well, it is important. I'm fine with optimism actually. However, there's reality here and there's a science. And without vaccine, there's no way we can control this virus. So the life is going to be completely different for the next 12 months at least. It's not going to go back to the way it was before this virus. The reason being is we need to create immunity. Immunity can happen in 2 ways only, either by vaccine, which we don't have, or by contracting the disease. If we contract the disease, we need at least 60% of the population to be infected. 60% in the States means thousands or 100,000 millions of deaths. Like President Trump is talking about 2.2. This is an accurate number. If we let the virus go around and infect other people, it's going to be a lot of deaths, and we need to prevent this. This cannot be accommodated in our healthcare system. We cannot care for all those patients, so the mortality rate will go up very high. So unfortunately, the only thing that is left for us is to mitigate it and make sure that we don't contract it, we stay home. And there's one more thing actually, which is very important. People who turn out to have the most severe form of the disease are those elderly people. And also people who have chronic diseases, such as chronic heart diseases, congestive heart failure, hypertension, diabetes, chronic lung diseases, chronic kidney diseases, cancers, or immunosuppression. We emphasize so much that those group of patients or people should stay home for sure. They should be served by the younger population. If somebody needs to get out and get groceries, it shouldn't be the elderly person in the family. And we need to care for each other. Actually, if we know families who do not have youngers, we need to serve them. We need to help them actually get them groceries so they don't get out. They don't have to go out and get their groceries actually. So
I think a lot of us used to yell at our parents used to yell at us to stay home, and now a lot of us are yelling at our parents
the
for
other
them
way
to
around.
stay home.
Correct.
That's
but
right.
this is
So
very important.
Absolutely. And that segues into a great question one of our viewers has for Dr. Syed, which is how should we handle groceries? We've all seen the video going around of, the person who compulsively washes each orange. On the other hand, a lot of people are just coming in and dumping everything on the table and saying it's okay as it is. Is there a balance between those? Do we need to be taking extreme measures? What does public health and safety look like within the household?
This question's for me, right?
Yes.
So I would say I'm also on the borderline of those extreme measures myself. It's difficult to say what is the right way to proceed. I do think personally, if you're going grocery shopping, I would suggest that people wear gloves, which may be an extreme measure, but it is more to speak to the point that Dr. Khairullah made before, that we're also interconnected with each other, that it's also not just for yourself, it's also for the other person that may come by and touch this. I don't think compulsively washing everything may be the way to go. I do think obviously you should exercise proper hygiene when you come, and you should normally we do wash certain items in our grocery shopping, so we should do that with more vigilance than we did before. But I wouldn't compulsively wash everything down or sanitize them or spray them down myself. I don't know, Dr. Khairullah, if you have anything to add to that.
No, I would agree with you, actually. However, if you wear gloves, gloves will not protect you if you continue touching your eyes and mouth.
Of course, with that.
So it's not actually any different if you touch a surface that is contaminated, and then you touch your face, whether you have gloves or not. So if you wear gloves, you need to pay attention, and then remove those gloves when you're done shopping. You need to remove those gloves and throw them in, and then on top of that, I would wash my hands. So the most important thing is to understand that touching the face is what make us get this virus, and we need to avoid this with our contaminated hands, and we need to get away from people. Do not get close. When we get to the cashier, most of the cashiers now putting gloves, but they don't put mask on, so we're getting close to each other. Limit that as fast as possible. Actually, then now you don't have to sign electronically. They just put the credit card and you don't have to sign. Most of the people eliminated that. Most of these businesses.
There is some social distancing enacted at grocery stores, at least in Massachusetts, where they don't allow you to come close to the cashier. Yeah. So there are some measures, but the triple threat that Dr. Khairullah mentioned: wear those gloves, burn those gloves, wash your hand, don't touch your face. So.
Correct. And limit your visits to the grocery. Make sure that you get all the stuff you need for 3-4 days. Actually, there's not going to be shortage. However, if you can limit the amount that the number of times you go to the grocery shops, it would be great.
And Dr. Khairullah, to that point, how can people boost their immunity? A lot of folks have been asking, well, how do we prevent ourselves from contracting the virus? And the thought comes up that, there's great ways to boost your immunity. Vitamin C obviously is a great way to boost your immune system. Supplements like zinc as well have been clinically proven to help boost your immune system. What do you recommend people can do to help boost their immunity to fight off this virus?
Well, there's nothing special for this compared to normal situations. Good sleep, balanced nutrition, and exercise. And if you want to get multivitamins, would be just fine. I do not necessarily advise of vitamin C or zinc, but this is up to the people to decide what they want to do on their own. There's nothing special that will prevent us from getting this virus. The things that are proven to prevent this virus from contraction is what we said: staying away from people, washing hands, and avoid touching the face.
And there was another question that a community member asked about vaporizers. So there were several videos circulating on WhatsApp and different various groups about people using warm mist vaporizers to help cleanse their nasal passages and their airways, to help alleviate symptoms like cough and shortness of breath. Is that something that is clinically you would recommend? You would suggest that to be like a source of
there's no scientific basis for all those methods to kill the virus directly. However, if it helps the person to moisten the throat and make it be better for him would be advised, but not with the purpose like this is going to kill virus. And this is only when there are symptoms. If somebody's got some sore throat or dryness of the mucosa, at that time it might help. But with the purpose that it's going to prevent me from getting the virus, I don't think so. There's no basis for this.
Okay, so as we're entering in the last couple of minutes, we have probably enough time for one response from each of our guests, excuse me, one response from each of our guests to speak a little bit about some of their other perspectives. We've had a lot of questions coming in, Dr. Sayed, about various medicines, interferon alpha-2b, tocilizumab, a lot of interferon alpha-2b questions. So if you could just speak very briefly about some of these pharmaceutical interventions and what people are thinking and seeing.
So the interferon alpha-2b, it may be a slight conflict because that is the company that I work for, it's Rebif. I would say that it is good that they're investigating that avenue. As you may know, or some of the audience members who asked that question may know, interferons of other sorts have been used in hepatitis treatment as well. So there was an idea that there may be some form of efficacy. The good thing about exploring such options where these drugs have been approved for another reason is that you don't have to go through the earlier phases of drug development, where you assess safety, because you spend a considerable amount of time assessing safety in the phase 1 and 2 of the trials and looking for doses and whatnot. So this takes us to a later stage where we can directly enter into phase 3. I would say that it is a good avenue to explore, and I am hopeful for the sake of humanity that it is successful. But it is early to say as of yet, but I think that that is one example of a drug that can bypass some of the earlier phases of drug development. Of course, we could have said the same thing about hydroxychloroquine and azithromycin, but those were really small trials. Here, I think there's a more concerted effort to find a very controlled, larger trial and to see what happens. And tocilizumab is also another drug, and it's used in autoimmune diseases. It's an antibody. I do think that that is being explored, if I'm not wrong, for like more of a pneumonia, more complicated case of COVID-19, only because it is a strong immunosuppressant. And it comes with a greater degree of side effects. That's usually,
what I was going to ask.
Yeah,
I was going to ask, how does the side effect profile compare with hydroxychloroquine, for example, or azithromycin?
So azithromycin, probably not like that terrible a drug because it is a mild antibiotic, but hydroxychloroquine has sort of heart side effects that can be somewhat serious if it's not properly managed. Monoclonal antibodies in general, I'm speaking very generally, not specific to tocilizumab because I haven't used that very much myself. They do suppress your immune system and can make you more susceptible to other infections and what have you. So you have to be, when I used to use monoclonal antibodies, you have to monitor those patients very carefully. So I do think that they're reserving those for more advanced cases. But again, I do think these are worthwhile avenues to explore, and I hope that something works out in the end. So yeah.
I know we all do. You know, all of us around the country are obviously hoping that these pharmaceutical trials are successful. In the interest of time, we're going to go ahead and get to wrapping up. So before we do so, if we can just have, if you both had one announcement that you had to put on a billboard, you know, sort of a 10-second blurb around this, what would it be for your one takeaway for everyone?
And one positive message as well, if you can make it uplifting, because I think a lot of folks are looking for some inspiration and some positivity in their lives. So what positive message could you share with folks?
Sure, Dr. Khairolla, would you mind please starting?
Well, I don't have a positive note actually. I would like to request everybody to stay home, especially the elderly and the patients who have chronic diseases, and limit getting out of home for those younger ones for only necessary needs in the community to provide basic life needs. Other than that, please wait. This wave is going to go down within the next probably 6 to 8 weeks, and we're going to go and see a very low number, but it may come back later on. So it may get better in the next 6 to 8 weeks, but we have to be careful after that.
Thank you. And Dr. Syed?
So I will try to put a positive spin on this. One positive thing that I have noticed that even though the social distance, I hope, to Dr. Hilar's point, has increased, this virus has created this interdependence that has brought people together in the Muslim community, and I would say beyond the Muslim community, because I'm working with multiple organizations right now, and we all have one purpose, and it has translated in some kind of save the humanity kind of situation, which I do hope we succeed in. My one ask, and I would say it's biased because of the work that I'm trying to do day and night, it seems like right now, is to engage with your representatives, with your lawmakers. They're in the office because of us, and we need to make sure that they're doing everything to make us safe. And of course, all things matter, the economy matters and whatnot, but there are some things that you cannot compromise, and health is one of them. And that health of our healthcare workers is imperative as well. So that would be my one ask, to activate on that point, because I think if we have a unified voice on that, we can actually change the trajectory, and that curve really depends on us, quite frankly.
Well, thank you so much again, both of you, for being here. It's been our absolute pleasure to have you. I know the community is grateful for all of your feedback, for your ideas, and for your vision in taking leadership roles in combating this public health scourge and this pandemic that's currently facing our country. Before we close, I just want to take a moment, and I want to take a moment before we close and encourage everyone who's listening today to remember that today is April 1st. It's the National Census Day. And this coming Friday, April 3rd, will be National Muslim Census Day. Census is a once every 10-year activity where every American is counted. And this determines where over $675 billion of federal funding is allocated. It's a critical time for every minority community to make sure that their voice is heard, and that every single Muslim in America in particular is counted. So please respond to your online census mailer. That's right. If you're respond to your online census mailer. It's the safest way to keep social distancing. And make sure also that you make yourself counted in terms of your racial category as well. We're urging people from MENA, Middle Eastern, North African heritage, regardless of religion, to participate in the census and to opt for, to write in their nationality of origin. Let people know that you are Arab or that you are from South Asian origin as well. This gives a good representation to the government, and it allows us to receive more accurate representations. So with that in mind, thank you again so much, everyone, for tuning in. Please continue to join us here every night at 8 o'clock, 8 p.m. Eastern Standard Time, for additional elements of the series. Thank you to our guests, and thank you to our audience.